Welcome to NTI in Practice, what national data reveal about engagement and impact. I'm Lauren Lynch. I'm the training coordinator for the Center for Adoption, Support, and Education. Just a few reminders. Your cameras are off and you are muted. However, we would love for you to be engaged today. There is a Q&A box that you may go to. That would be the perfect place for you to put in any questions. And we are going to save time at the end after the presentation for plenty of questions. So as they're presenting, if something comes to mind, go ahead and put it in the Q&A box. And I am going to turn things over to Dawn Wilson, who is the Director of Training for the Center for Adoption, Support, and Education.
Thank you, Lauren. Hello, everybody. We're so happy to have you with us today. I'm very excited that we have an opportunity to share with you some information about a training that's sort of near and dear to my heart, our NTI, our National Adoption Competency Mental Health Training Initiative, and about the findings from our evaluation. So what national data reveal about engagement and impact? Really excited to have you with us. You want to go to the next? Oh, I'll do the next slide. There we go. Okay. So as Lauren said, I'm Dawn Wilson. I am the director of the Training Institute at CASE, and I'm also the director of the National Adoption Competency Mental Health Training Initiative. So I'm joined today with two of my colleagues, our evaluators and professors at the University of Nebraska-Lincoln Center on Children, Families, and the Law, Dawn Davis and Megan Paul. And we're really excited to be able to talk with you today. Before we go over the agenda, I do want to just talk a little bit about finding out more about who you are. So we do have a couple poll questions that we're going to ask you to just answer to give us an idea who's in the room with us, so to speak. So Lauren, can I ask you to share that poll? Here we go. So the first question is, what discipline do you primarily work in? We know that some of you work across disciplines, so you can just pick and choose what makes the most sense for you. Child welfare, mental health, education, juvenile justice, or other. And then the second question, are you familiar with NTI? Have you heard about our training? No, it's new to you. Yes, I've heard of it. Yes, I'm pretty familiar with it. Or yes, I've taken the training or our organization is using the training. So if you will take a minute to answer those questions, and then we'll show the results and we'll know who's here. And also, as we're going through the training, if you want to add in the chat where you're from, what your role is, that will also help us know who's here. Are we getting some answers, Lauren?
It looks like we have 65% participation.
Okay. Why don't you go ahead and show, let's see, we got, all right, so about 61% child welfare, 18% mental health, about 4% education, and 16% other. Familiar with NTI? No, it's about 40% of you, it's new to you, so that's exciting for us to be able to expose more folks to our NTI training. 30%, yes, I've heard of it. And 11% pretty familiar, and about 20% of you are using it. Either you've taken it yourself or your organizations are. So, okay, that's good for us to know. Thank you for participating. Again, as Lauren said, be sure and make comments in the chat. If you have specific questions, we would ask you to put those in the Q&A box. Okay, well, let's move ahead. Okay, a little bit about our agenda. We're going to talk about a brief overview of our NTI training, talk about the framework for our evaluation. We're going to discuss some of our key findings from the evaluation. We're going to talk about how data are being used by organizations. We're also going to share a bit about the supports that we provide to organizations that want to implement NTI. And we're going to spend maybe about 30 minutes toward the end doing Q&A. So we'll make time for that. All right, so as I mentioned, the focus of this webinar is on our National Adoption Competency Mental Health Training Initiative, or NTI for short. And I thought it might be helpful for us to do a little grounding on what we mean by adoption competency. So this is a term that might be familiar to you, but it might not. So if it's not familiar to you, adoption competency is not a specific practice or intervention or model. It is a comprehensive set of knowledge, value, and skill competencies that are rooted in research and evidence-informed practice that have been found to be more responsive to and effective with adoptive, foster, and kinship families. This work started with a focus on adoptive families, which is why it's called adoption competency. But we've really found over the years that the competencies apply more broadly to the foster and kinship community as well. So hopefully that gives us a little grounding on what we're talking about. I want to share a little bit about the training, since we do have a sizable number of folks who don't really know a lot about our training. First of all, our NTI training is federally funded. It is a training initiative that's led by the Center for Adoption Support and Education, so our organization. The focus of this training is really about building the capacity of the child welfare and the mental health workforce to address the normative developmental hurdles and the mental health challenges that youth have when they experience foster care, kinship care, and adoption. We have two curricula. We have one that is focused on the child welfare workforce and one on the mental health workforce. So on the child welfare side, this is a 7-module, 18-hour curriculum for child welfare professionals and paraprofessionals, sort of broadly, in both public and private settings, who will work across the continuum of child welfare services. So that can be from prevention and child protection to post-permanency. This curriculum is casework focused, so it's really about how to do the work with children and families when they're in front of you. This is not policy or theory. It is strategies, tools, resources for how to do the work, what to say, how to interact. There's also a 21-hour curricula for supervisors that includes an additional lesson with each module that helps supervisors to support their staff to apply what they've learned in practice. So we want to support supervisors to be good coaches for their staff to apply what they've learned. On the mental health side, the training is for mental health professionals and paraprofessionals, again, broadly. We don't require any specific licensure or degree. People can self-identify as mental health professionals. We're looking at mental health professionals in both public and private settings, also in private practice. It is a 9-module, 27-hour curriculum with a clinical focus. So here we have a lot of shared content, which I'll go over in just a second, between the two curricula. But on the mental health side, there's more of a focus on assessment, treatment planning, therapeutic parenting, kind of the skills you can use with families when you're working with them. And also want to add that if folks take this training on our case learning management system, which is called the Case Institute, we do provide we provide CE credits either through the University of Connecticut School of Social Work, NASW, or MBCC, which is the National Board of Certified Counselors. So we're very excited to be able to offer those CE credits for free. So a little bit about the competencies that we're focused on. As I mentioned, we have some core competencies across both child welfare and mental health curriculum. So those are the first 6 that you see listed. We are focusing on helping professionals and paraprofessionals understand what the mental health challenges are that children and families experience. What are the specific needs and the limitations of treatment, that sort of thing. We're talking about understanding loss and grief and how that loss and grief for this particular population is very different from the kinds of losses many of us have experienced. We talk about the impact of trauma on brain development and behavior, and how we can support children and families who've experienced trauma. We talk about the importance of supporting strong attachment and bonding, and how to promote attachment and bonding within families. We focus on positive identity formation. And so here, what we're really focused on is how do we help children who don't know where they came from or have missing information about who they are feel a strong sense of self. So both identity and a sense of belonging. And then, of course, we're focused on this need for ongoing supports post-permanency. So, the need doesn't just exist at the beginning of an adoption. It can happen during different milestones and phases of development. So that's important. The last two are the additional modules that we provide for the mental health workforce. So again, we're looking at assessment and treatment planning through an adoption lens, and how assessment looks different when you are focused on working with children who've had experiences of separation from birth family, loss, trauma, etc. And then the other module is the therapeutic parenting strategies to address challenging behaviors. So we really want to support children and families to have the tools that they need to be successful. So that would be the additional second module for the mental health side. All right, so that gives you just a brief overview of our NTI curriculum, and I'm going to turn it over now to Megan Paul to talk a little bit about the evaluation.
Thanks, Dawn. So very briefly, as an evaluation overview, our primary purpose is to understand and improve the training effectiveness. And we do that by answering a few questions that we're going to cover today. Who takes NTI? What are their perceptions of the training? What impact does it have? And what characteristics or supports are associated with completion? Now, we have a number of other questions that we're also assessing in our evaluation, but these are the ones that we're going to focus on today. In terms of how we do that, participants get a fair number of surveys. We also have pre and post knowledge tests, multiple choice tests. And then we use our system data, that is our learning management system data, to see how people move through the training. As an overview of the participation that we're covering here today, it spans the period from October of 2022 to September of 2025, so roughly 3 years, which is only a slice of the NTI participation in the overall lifespan of NTI, which started with a pilot, the initial pilot in 2017. And so it's been many years, but this is a slice. And during the slice that we're talking about, we're covering over 6,500 people who are enrolled and over 2,000 completers across the 3 curricula. Across the lifespan, we do have over 12,000 people who have completed over the 9 years or so. But this is the slice we're looking at today. The first thing I want to start with is the idea that NTI meets a critical need. So I'm actually backing up a little bit. This gets at why NTI was developed in the first place. And I'm just going to give some very quick stats and quotes about experiences. There's many more in the training, and you can take that to learn more. Lots of research behind this, and this is probably familiar to a lot of you. But some real quick stats here. Adoptive families 3 to 5 times more likely to seek mental health or other counseling services for children, 7 to 10 times more likely to seek residential treatment than birth families. Among youth in foster care, by age 17, almost 2/3 will exhibit both the symptoms of a mental health challenge and the symptoms of trauma. And they're significantly more likely than their peers to have a mental health diagnosis. And many, many more stats to go with that. In terms of experiences, here are a few quotes. I'm sorry, a little lag in the advancing here, apologies. They failed to validate or believe my experiences, failed to include me, didn't understand the issues, told me to just give my child back, felt blamed for everything. From children and youth. When I brought up the things I lost, they talked about all I was gaining. Made me feel bad about wanting to talk about my birth parents. No one ever talked about adoption, and they told me to be grateful. Okay, so lots of evidence to establish need, testimony from families and children and youth, and research and so on. So we've established that there's a gap, and there's a need, and our pretest scores, corroborate that. So we'll see, and Don will share more details around that there's plenty of room for growth, and that's what NTI is for. So in terms of the gap, it's missing from formal education and standard training by and large. There's data around that to show that it's just the tiniest slice, if at all, mentioned in many standard curricula and professional education. There's are limited alternative training opportunities available, obviously NTI being one of the very few. And therefore, as a result of all that, there are few adoption competent professionals. Even among the 10,000 completers that I mentioned, only 3,000 of those in the 9 years are mental health professionals in terms of having taken the mental health professional training that is. And though families are certainly expressing the need for something different, there's low awareness among them of a solution of people who are trained in adoption competent care. And low awareness among professionals to know that's even a thing that's needed and that it's something they could learn more about. And then ergo, there's limited access to providers as well. Now, moving on to some of our data from surveys. In terms of our reach, real quick snapshot there of folks in this data period. They're all over the country. The blue is people who are enrolled, and the orange is people who are completed. And each dot represents a person, obviously more heavily concentrated in more urban areas, but all across the board there. In terms of reach and in terms of organizations where people are at, this is a sampling, the more common types of organizations or disciplines, state child welfare and mental health agencies, mental health providers, that would include, among others, community behavioral health centers, residential treatment centers, private providers, managed care organizations, juvenile justice, and family and youth organizations, among others. So keep this in mind when Dawn starts sharing more about the stats that, what a spread we have here in terms of occupational and professional background. In terms of child welfare agency involvement, which is not the full gamut, this map displays in green those states where child welfare agencies are implementing NTI in some form or another, some with stronger partnerships with CASE and some with less so, with 14 of those requiring NTI for their child welfare staff. In terms of professional role, you see the numbers there. By and large, child welfare professionals there. These data are collapsed across the 3 curricula, by the way. Child welfare professionals are the most predominant roles that we have in terms of taking the training. And then some social workers, mental health professionals, and on down from there. Years of experience. You can see the largest number are people with a lot of experience. And we hear from a lot of folks who have that long experience who say, boy, this would have been great earlier in my career. They're so glad they've taken it, but they do have regrets about the years where they wish they had known more, didn't know what they didn't know. In terms of educational background, master's degree is most prominent, followed by bachelor's degree, which is not surprising given the populations we're working with. And in terms of licensure, we ask only in the mental health professional training about this, even though we know there are plenty of child welfare workers and agencies where licensing is required. And the largest percentage are working towards a license. So that means they're early in their career, I imagine, more often than not, which is great to hear. And then we ask about personal connection to adoption, guardianship, kinship, or foster care. And so we have a very sizable proportion who do have that personal connection. So, it's likely that people who have that connection are more likely to seek this out. And we're seeing that here. In terms of completion, you can see the numbers there about, this is people who start the training and whether they complete it, 54, 38, and 32%. There is a guideline, a recommended guideline to complete within 6 months. And these are the proportions that do achieve that goal. So those are much higher. It's doable in 6 months for sure. of those that do not complete, I should note that the most common reason they say is they don't have time, which is understandable. This training does take some time, and although it's flexible, and that's the great thing about it, it does require a fair amount of self-discipline to get there, to do it for a self-paced training. And some others say I was only required to do modules, 1, 2, 3, and 4, or whatever. So I wasn't required to do the remaining modules. So that's the reasons. Don will talk more about that. And then in terms of the actual number of days it's taking, some more short of 6 months, the median is, as you see here, 46, 92, and 93 days. That's, of course, time elapsed on the calendar, not time spent per se, which is, still less than a typical college course. And so it's very doable in that time if you're disciplined and focused on making your way through. And of course, as Don mentioned, you can get continuing education credits for that work. And now I'm going to pass it over to my other Don.
Great. Thanks, Megan. So I am very happy to share with you more of the data, and specifically, I'm going to focus first on how NTI has impacted those who have taken the training. And the first thing that we looked at is really what we see throughout the data is that NTI is meeting the need that Megan talked about. So thinking about the research and the gaps and the need, what we see is that NTI is improving skills, attitudes, and effectiveness. It is showing people who take NTI show knowledge growth, as well as they report increased competency in their work. And so we really do feel as though that connection is being made between the need and what NTI is providing. What we see here in terms of these changes in NTI participants is they're learning something new. You can see on the bar chart that between 85% and 91 or close to 92% of participants agree or strongly agree that because of the training, they've developed new skills. And that the statistic about the years of experience, it doesn't matter how long you've been working in the field, there is new information and there are new skills that people are gaining from NTI. And you can see from our qualitative data that people are talking about just how much they've learned. They also share with us how relevant it is to their work, how engaging the material is as well. In addition, we asked about changes in attitudes, and we see again here very high numbers, 83 to 85% of participants agreeing or strongly agreeing that it has affected their attitudes about these topics. And from the qualitative data, what you can see is that it's really driven by being exposed to the different perspectives. So within NTI, there are videos and examples and role plays from youth with lived experiences, from adoptive families, from foster families, from mental health professionals, child welfare professionals, and supervisors. And by being able to hear about those lived experiences, NTI participants really are changing how they see and how they feel about the families that they're working with and the issues that they're working on. Then what we've done is we've asked about how NTI participants feel this will impact their work and their effectiveness with the families that they work with. This is another item with very high levels of agreement, and there's this strong belief that they've reported when they complete NTI that this is going to make a difference in their work. And so when you think about the amount of time that you invest and really will it make a difference? Will it pay off? And what we're seeing with these data are that, yes, it is changing. It's building skills, it's changing attitudes and beliefs, and that they're feeling as though this is something that is increasing the effectiveness of their work. So along with those impacts, we also look at knowledge growth, and we measure knowledge growth using a pre and post test for each module. So the 7 or 9 modules, depending on the course. They take a pre-test before and a post-test after. These are multiple choice between 20 and 25 items, and they take the pretest once. And then on the post-test, they do have to achieve a score of 80% or higher to pass that test. And in order to be considered complete for NTI, you do have to pass all of the post-test. However, you have unlimited retakes. So we do look at how often or how many times does it take a person to pass the test, and we use that information. And when they are taking the test, they do receive feedback. So they're told if an item is incorrect, where that information can be found in the training so they can go back and review as needed to make sure they're learning. So when we look at the pre and post-test data, what this chart shows is actually combined and it's collapsed across all of the modules. So you'll see the mean in orange is the mean pre-test score across all modules, and the green is the mean post-test score. And huge gains here, around 37 or over 40% difference in the pre and post test scores. And for every module in every course, we have significant differences between pre and post test. So the answer of is there knowledge growth after NTI is clearly a yes there. All right. The other thing that we ask about is NTI participants rate their self-reported sense of competency around adoption competence. So Dawn mentioned the areas of competence for NTI, and they're asked before they start the training as well as after they start the training how they would rate themselves on a 1 to 5 scale, with 1 being that they're just beginning to be aware of some of these ideas and competencies, all the way up to a 5, which is that they feel like they've mastered them. They can explain them to others. They can use them in their work. And there are 15 items on that assessment. And some examples of those items include, you'll see this is related to the slide that Dawn shared, employing an approach that are family-based, strength-based, informed by evidence, and recognized as clinical best practice. That's clearly aligned in what NTI hopes to build and achieve. Also around engaging adoptive, foster, and kinship parents as partners in the therapeutic process and primary agents of healing as well. So really be that inclusive approach. And then another example is demonstrating an awareness of the impact of the birth parent's psychological and sometimes physical presence in the child's life. So thinking about ambiguous loss or grief, or how, even though it might not be there in front of them, how those things are impacting the child's attachment and development. So when we look at the change between before NTI and after NTI on these self-ratings of adoption competence, we see, again, a significant change, a significant growth between pre and post-test for all of the courses. And when we look and combine the courses, we see the biggest changes in items around understanding adoption-related challenges, as well as promoting help seeking as a strength. So again, thinking about what are the knowledge and what is the awareness that's changing with NTI participants, becoming aware, just aware of what these experiences are and the challenges that these families and children are facing. And then thinking about promoting help seeking as a strength. We know that adoption is a lifelong process. We know that there's much work to be done to reduce the stigma around help seeking, and really wanting to normalize the fact that, adoption day is a great and exciting day, but that's not where things end, and that's not where you should think that there isn't help needed after that. All right, so we have those changes as well. And then we really, along with the impact there, we wanted to look at what participants perceptions of NTI were. How did they think? How did they feel about something that they had spent so much time on doing? And what we learn, again, through the data is that participants enjoy NTI. We have lots of comments and data supporting this. We have some qualitative quotes here. And then at the end of the training, we simply ask them, overall, how satisfied are you with the training? And 87 to 92%, agree or strongly agree that they were satisfied with NTI. We asked them a lot of other questions that we're not sharing today about organization and the content and other things as well. But the key takeaway here is that with this training, they are satisfied with it. The majority of participants are satisfied. And then we are sharing this because I think it's really telling as well, is that we have a high percentage of participants who report that they would recommend NTI to other professionals. And what we see in the comments is not only would they recommend it to professionals in their own field, they would love for professionals in other fields that they engage with to take NTI as well. And I think that does support the approach of NTI to, have child welfare and mental health, but it's also expanded to other professionals and systems who serve these children and families to give them a common understanding, language, and approach to support these individuals. And yes, so you'll see that we have many comments about, oh, it would be great if everybody in my agency, everybody in the field, and everybody working with these children and families had this information. So thinking about the data, we do a lot of data collection and analyzing and reporting and sharing, but the value is really in how are they used? How are data being used to impact implementation or the experiences of people taking NTI? What can we do with what we're learning? And so in terms of how data are being used, there are several different ways. The feedback data that we receive are used to improve NTI. So really thinking about what are their experiences, what are their suggestions for improvement. And a great example of this is in November of 2025, a newly enhanced version of the mental health professional course was released. And this is just a highlight of some of those improvements. And many of them were informed by the data, as well as a very rigorous and intense review process that Dawn Wilson and her team took with input from professionals from the field, lived experience, and other guidance to really make sure that the revision was meeting the need that they heard. So some of those included a new content, reducing time. We always know that time will be a factor. However, there's so much information that's important, and we know they're not getting it elsewhere, that time is you have to make that commitment. There are also new videos and resources, making sure that the research is up to date, making sure that everything is what we currently know about how children and families heal and best practices for them. In addition, there were some other functional things like playback control. So anybody that's listened to a podcast or watched a video loves to be able to control the speed in which it's playing, and having engaging activities. We get lots of feedback about how NTI does work to keep you engaged and have you do activities throughout. Wanting to ensure that there's strength-based language, and we use the data to improve the pre and post test questions to make sure that there were appropriate levels of difficulty, that they were aligned with the content, and were well written tests. So in addition to improving the NTI training, data are also used to support implementation, and that is through different avenues as well. So we know that organizations and staff need support to complete and implement NTI effectively. And so I'll be sharing a little bit of data about what they need and how those supports can help with completion. The NTI team and others also need information about how many people are enrolling and completing and what do they look like and where. And so our team works to create dashboards that take the learning management system data, and we have a live dashboard that shows enrollments and completions, and they can watch that over time. So they can see if there's an uptick, is that a result of a conference or outreach or some activity that they're doing? Was that having an impact on what we see? And then certainly for reporting and understanding and guiding their work. And then in addition to that, really want to use the data to learn from experiences. So taking the lessons learned, taking the information that we have and sharing it with others so everyone can benefit from this information. So when we think about what helps people complete NTI, we looked at every item that we collect, so all of those things that Megan went through, and we found that it doesn't matter your education level, your years of experience, your role, or if you're licensed in the MHP course. Those did not determine whether or not you completed NTI. You were just as likely to complete or not complete if you had 10 years or 1 year of experience, which sometimes can be a little bit surprising. What we did find is that what matters is employee requirement. And so you'll see here that these are anybody that takes NTI, whether they've completed it or not, but most people who enroll in NTI are required by their employer to do so. And a little less than half of the MHP participants are required. And then the others are taking it for their own interest as well. And what we see is that the strongest predictor of completion is employer requirement, which might not be a big surprise. But when you're working with agencies or other organizations thinking about implementing NTI, or if you'd like to take NTI, having that employer requirement does give you the structure and the support that makes you much more likely to complete the training. So in addition to employer requirement, we asked NTI participants what other supports they received while they were taking the training. And for people that completed NTI, what we saw is this pattern of support. So the completers had protected time, not just, oh yes, you can do NTI during your work hours, but I have a scheduled time that is free of disruptions in order to take NTI. Having protected time made someone 2 times more likely to complete NTI than someone who did not have protected time. In addition to that, strong supervisor support. Does my supervisor encourage me to take NTI? Are they checking in with me? Did they recommend that I take this and they're happy that I'm doing it? Supervisor support makes a participant 4 times more likely to complete NTI. And then this peer momentum. So taking it together as a group in your organization, having those conversations and abilities to debrief and talk about what you're learning, that also supports completion, and individuals are twice as likely to complete NTI when they have those supports in place. Now, on the flip side, we did survey individuals who enrolled in NTI and started, and then 7 or 8 months later, they hadn't completed. So we reached out and we did a survey saying, hey, we want to understand the barriers and the challenges to completing NTI. We've already mentioned that time is certainly one of them. And what we found is that they were much less likely to have these supports in place. So what does that mean in terms of working with agencies and giving them guidelines and recommendations? Certainly understanding the data and what's needed. And so data to support the agencies, they can actually request from their NTI implementation specialist data around their staff and monitor progress. And these have been used to help with setting benchmarks for completion. So understanding understanding how your staff are moving through NTI. The general guideline is 6 months, but some agencies that might be 4 months, and some agencies might choose to take a year for their staff. So understanding if that's a realistic expectation and how their staff are progressing. We also see data used to inform future phases of implementation. So knowing when you've had maybe a large group complete NTI and preparing for those next steps and making sure that there's that transfer of learning and that it does become part of their practice. It's helpful in identifying and addressing barriers to implementation or completion. So understanding what supports can be added in. Fine-tuning promotion or communication strategies. Some agencies have used incentives or recognition to support, and then communicating regularly. NTI sends out every 2 weeks. You get a reminder, you're working on it, keep going. But agencies themselves might also want to send out information too. It helps identify gaps and gains in knowledge so that those pre-tests can really help identify what staff are learning and how that can be, again, supported. It helps set future professional development needs. So knowing this is the content that my staff have, this is a skill that's maybe recently learned. It needs to be, practiced and do some check-ins, and then finally to provide opportunities to celebrate those gains and successes as well. We really want to make sure that it is a commitment, and when people complete NTI, that is something that can be celebrated. Okay. So those were the data and specific uses for the data. And I started to talk a little bit about supports for NTI, but I'm going to turn it back to Dawn Wilson to talk more about how CASE and the implementation specialists work directly with agencies.
Thank you, Dawn. So this is a lot of really great information about how the training is received by the folks who are taking it and how organizations can use it. And, one of the things I think that we've learned over a number of years, I mean, I mentioned at the beginning, this is a federally funded initiative, and we've been working with sites to implement NTI since about 2019. And, there are a lot of things that we recognize about the challenges for child welfare and mental health systems. We know that for the most part, folks don't come into this work, with this expertise. I mean, that's true whether you're, the child welfare, mental health professional. We aren't getting this kind of specialty knowledge and information in our graduate or undergraduate or any other education generally. We know that outcomes, as Megan shared earlier, for a lot of children and families is poor. It's not where we want it to be. And so we think about what happens when staff are doing work with children and families and don't have the skills and the resources and the tools or the confidence, and the feeling that they have a skill set to really support children and families, when they aren't able to have conversations about what it means to feel disconnected from your birth family and community, or how it feels to not know who you are or where you came from. I mean, all these kinds of things. If we aren't having conversations with kids about those things to help them process their feelings and thoughts, then they're not going to be in a readiness for permanence, whatever that permanence is. And so, when I said at the beginning that we really are focusing on trying to help support the workforce to address the mental health challenges of children and families, that's really what we're talking about. And in order to do that, there are a number of things that we do with organizations. So obviously we want everyone who can to take this training. Our goal is to make NTI the standardized training for child welfare and mental health professionals, paraprofessionals who are serving this population. And one of the ways we do that is that we work with organizations, child welfare systems, mental health providers, whomever, to help them implement NTI with their organization or their system. And so I'm going to talk a little bit about some of the ways that we do that. Excuse me, I feel like I'm losing my voice a little bit. So I have a team of implementation specialists, and their job really is to work specifically with organizations in designated states to help them implement NTI. And that can look a lot of different ways. So we can help organizations who are interested in housing our training on their own learning management system, so we can help you integrate it. We can work with you if you want to use our learning management system. And our goal is to make NTI as accessible for you and your staff as possible. So I have a team of implementation specialists, and really what they're focused on is working with a leadership team in your organization to walk through the sort of questions that need to be answered in order to develop an implementation plan that works for you and for your workforce. And when I say workforce, that could be your internal staff, your contracted providers, your behavioral health provider network, whomever that is. So this includes determining whether the training will be accessed on your system or not. It includes answering the who, what, when, and how questions. Who'll take the training? Which curriculum are you going to be using? Are we going to mandate the training? What kinds of supports can we put in place, as Dawn Davis just talked about, that can help to support completion? Our implementation specialists can work with your team to facilitate kickoff meetings, to create excitement about the training. They can lead webinars about the training to help inform your other leaders in your organization and staff. We have access to communication tools and communication support, so templates and emails and things like that that you can use for promotion. Our implementation specialists are doing things like troubleshooting integration challenges. So if you're trying to figure out how to best support your staff, we'll work with you on what are other systems doing? How can we help you tailor a plan that works for you? And then we're also going to be working with you to think about the transfer of learning piece, because what we know about training is that just a training that's one and done isn't going to have the impact that you want or that we want. And so we want to support that by doing things like offering coaching cohorts for your staff and supervisors, or talking about other kinds of transfer of learning opportunities that your organization can put into place to support your staff. So when I talk about coaching cohorts, again, we like to say NTI is not just a training, it's practice changing, but it's only practice changing when people actually apply what they've learned into practice. I mean, that's pretty common sense. This training, I want to just sort of step back and say this training is free. It is free for organizations. There is no cost to utilize this training. Yes, there is a significant time investment to complete the training. And obviously, if we're including things like coaching cohorts, there's also a time investment for that. And we recognize that. But the actual use of the training and implementation and the other supports we provide to you are free. So I just want to sort of put a plug in for that. We want to again make this as easy as possible for organizations to both implement the training, integrate it into your training array, and to sustain the training over time. We don't want this to be just a one and done kind of training for your staff. We want it to impact practice so that children and families can benefit from that. So we are talking through coaching cohorts about things like meeting together in a group. Dawn talked about, when you go through this with your peers, it's going to have more of an impact. Well, this builds on that. So we want to deepen that shared learning among peers. We want to integrate case consultation. These would be cases that you come to the meetings with about your families that you're working with, where we can then talk about the tools and the resources and the different supports that you can utilize from the training to support the families that you're working with. These coaching cohorts can be designed in different ways, but for instance, we can have, if it's 7 modules for the child welfare, we can do 3 or 4 sessions where we combine 2 modules at a time, or we can do 1 a month and do one module a month where you're focusing on one competency area for each coaching cohort. On the mental health side, we can do something very similar as well. So again, this is a support for you for your folks who are taking the training to get what they need to really incorporate and transfer that learning to practice. And then just in terms of other supports, we have an NTI toolkit that includes sort of an implementation checklist, implementation plan. I mentioned a transfer of learning guide. There's lots of different ways we can support transfer of learning. We have pitching documents that help to sort of talk about the value of NTI for different populations. We have a supervisor coaching and activity guide. So this is an activity guide that supervisors can use to come up with activities either with individual staff they're supervising or in group supervision that again help to apply learning from NTI into practice. We've developed tip sheets about each of the modules that really kind of help you sort of highlight what is the main learning from this module. And then again, I mentioned the communications and marketing toolkits where we want to make it easy for you to promote NTI. So we've got wonderful templates that you can pull from and a marketing manager whose expertise you can also utilize to support your marketing efforts as well. We, of course, want to make access to NTI easy. And it's pretty much as easy as accessing our website. And here it's adoptionsupport.org/NTI. There is a lot of information we have available on the website about the child welfare curriculum or the mental health curriculum. We have demos, demo lessons that you can use, you can kind of play with. We have lots of resources that I've just mentioned on our website. And then there's also an access tab where you can just go right to the access tab, get the link that goes to our learning management system portal and enroll again for free in the training. And you can choose which of the trainings you want to enroll in. Obviously, part of our job, as I mentioned, is to work with your team specifically about your needs. And so you can enroll individually, but if you want to have a conversation with us to help us sort of figure out the enrollment and the implementation, then our implementation specialist can meet with you directly around that. And then I didn't say this at the beginning, but I think it's important to really understand that NTI is part of a broader approach in our organization to building or enhancing adoption competency just across the workforce and across the field, so to speak. We're engaged in a number of different activities at different levels to support adoption competency. So we are CASE is the leader of the National Center for Adoption Competent Mental Health Services. Again, a federally funded initiative to build bridges between child welfare and mental health systems. With the goal really to make sure that adoption competent mental health systems are accessible and available to families in states across the country. And the National Center is working with states, tribes, and territories to do this work. If you're interested in being a part of National Center work, you can also reach out to me, and I'll give my email in just a minute, and I can connect you with the right folks there. I've mentioned, of course, NTI. We consider that the foundational training for adoption competency, but we also have the next level, which would be our training for adoption competency, or TAC. That would be considered the deeper clinical dive for licensed clinicians. And then the CASE Academy is one of our newest programs at CASE, and it provides a more immersive clinical experience for both folks at the front of the career, so graduate interns who are in graduate school, and also professionals in the field who are at the intermediate and advanced level. So we're doing coursework that can support that learning at both levels. So I just think it's important for you to see that at CASE, we take this sort of focus on adoption competency very important, and it is sort of the foundation of the work that we do, and NTI is a part of something bigger as well. All right. All right. I think we're pretty close to 3 o'clock. So I hope what you've heard today has excited some of you and encouraged you to want to be involved in NTI if you're not. I mentioned earlier that we think about NTI as not just a training, but as practice changing. And that really, is our goal. We know from our evaluation and from our work with many organizations over a number of years, the impact that NTI has. We know it fulfills a critical need. We know it impacts the workforce in meaningful ways. We know it's enjoyed by staff. That includes staff on the front end of their career and also those with many years of experience. We know that NTI includes comprehensive supports, and we use the data that we gather to help improve curriculum improvements, implementation guidance. We are trying to learn from those of you who are taking the training as well. And as I mentioned just a minute ago, NTI is part of CASE's work overall to build and enhance the adoption competency of the child welfare and the mental health workforce. And I guess I would say I want to ask you to come alongside us and be a partner with us in making sure that the workforce has the skills that it needs to provide the support that so many of our children and families so desperately need. So I guess I'll end there. And I think the next slide we'll have our email addresses. So I will say it's not often that I'm in a webinar with another person named Dawn. So we don't want confusion. I'm Dawn Wilson. So if you want specific information about how we can help you implement NTI with your organization, please send an email to me and I'll be happy to connect you with our specialist. If you have questions, comments about the evaluation and the findings that were shared today, then Dawn Davis or Megan Paul, you can certainly reach out to. And if you get the wrong person, we'll get you in the right place for sure. But again, we want to be supports to you, and we do want NTI to be the standardized training for child welfare and mental health professionals and paraprofessionals across the country. Okay, so I think now Lauren will open it up for any questions. I don't know if we've had any. If you have any questions, please feel free to put it in the Q&A box. And I did see some comments in the chat, some folks who wanted to know how to reach out. So wilson@adoptionsupport.org if you want implementation support, and we will get you in the right direction.
I think there was a question that was in the chat, not in the Q&A, but
Okay.
From a foster parent asking about if NTI was appropriate for them.
Oh, for foster parents.
Yes.
That's a good question.
I'm not sure if, Lauren, if you want to put our evaluation survey in the chat as well. I might have just, yeah.
So it's a good question. I'm going to assume you're asking if the training is appropriate for you as a foster parent to take. So if that's the question, really anybody can take NTI training. I wouldn't dissuade anybody who's interested from taking it. I think what's important to know is that when it was developed, the child welfare version was developed with people who work in the child welfare field more broadly. So it's going to be written to you as if you're, working in the field. Same thing on the mental health side. It is written as if you are a mental health professional or maybe a therapist or clinician working with children and families. We know not everybody is in one of those particular situations. And so you kind of have to, when you're taking the training, just be aware that how it's framed may not fit necessarily your role or who you are. We did try on the child welfare side to make it more broadly appeal across the continuum, because we know that while folks who work in the adoption field are on sort of the back end of the continuum, the decisions that result in children moving to adoption are being made at the front end, right? So children come into care through Child Protective Services usually. And those folks, I think, need to have this understanding as well because they're making decisions that impact the lives of children and families, from the beginning. So I don't know if that answered your question. You can certainly take the training. Just be aware that it might, all the framing may not work exactly for you. If the question is about whether or not the content relates to foster care, the answer is yes. We definitely did develop the training with the thinking about children in foster care, those who are adopted, or those who are in relative care or kinship care. So I hope that answered that question. Can you share how an organization may access training from NTI? Thank you, Craig. So one of the things that our implementation specialist is going to do is probably want to reach out to you and have a conversation about what your interest is. Are you an individual who is looking to do this training? If so, you don't have to go through an implementation specialist. You can just enroll directly in the training from our website. But if you are interested in having staff within your organization or constituents that if you're part of an association or an alliance or a provider network, whomever it is you're interested in being trained, we're going to want to talk to you really about who they are, which curriculum are you interested in, do you want to house this training? Do you want to use our learning management system with access to our continuing education credits? And then again, answer those questions that kind of help us to frame the implementation in a way that works best for your organization. But I will say this, if you're using our learning management system, people can access this training starting today. I mean, it's there and it's available and it's free. For organizations that want to host this training, it does take longer because there's a whole, the files have to be uploaded and that takes time. And both of those options can work depending on your particular needs. But that's one of the things we'd want to talk through with you. So I would say, Craig, if you want to send an email to Dawn Wilson or Wilson at adoptionsupport.org, and I'll put it in the chat again, then we'll be happy to reach out to you directly. And if you are in our website, the NTI website, there also are there's an inquiry form that you can fill out, and we respond to those inquiries regularly as well. Any other questions? Do we see any others? Is there a difference if you obtain the training from NTI or CASE directly? I have my TAC from CASE, but wondering if NTI is different. Teresa from Austin. Thank you, Teresa. So I think if you're asking, is there a difference if you obtain there's no difference in the content of the training, no matter where you access it. The training is the training. So if you're accessing it through our learning management system or some other system, it's going to be the same training. Whether or not you have access to continuing education credits might change or be different, because we can offer CE credits, for instance, through our learning management system. But those aren't transferable to other systems. So another system would have to then figure out how they're going to provide CEs if they want to provide CEs, unless they're a CE provider. If you're asking if NTI is different from TAC, the answer is yes. There is some overlap in content. So it's probably true to say that if you've taken TAC, you're going to, and then you go and take NTI, you're going to see some similar content. We think of NTI as the foundational training. So if you don't really know anything about the needs of this population, NTI is where you would start. And it's sort of the undergraduate school of adoption competency. And then TAC would be sort of the graduate school of adoption competency. So TAC is going to be a more deeper clinical dive. It's going to be much more focused, because it is for licensed clinicians. It is going to be much more focused on clinical practice. There might be some differences in how information is shared and some different kinds of tools that are in our curriculum versus that one. And again, some of the concepts will be similar. But I have had people who took TAC and then took NTI and got something out of it. So it's certainly available for you to take it. It's not going to be all new content, though. I guess I'll say that if you've already taken TAC. So that might be a consideration. I hope that was helpful. Anything else? I do want to just say when Megan and Dawn were sharing their data, and I'm immersed in this pretty much every day, but seeing the data, even for me, sometimes kind of like brings me around and is a reminder to me. But I was thinking about the pre and the post test and how over the years we have seen, as Dawn said, significant gains from pre to post test. Um, and one of the things I've said before when I've done meetings with sites is one of the things that one of the comments it's just sort of burned in my head that we had from somebody who took the child welfare training who said she didn't know that it was her job to talk to kids about why they aren't with their birth families. And I remember when I heard that comment thinking, well, if we haven't trained someone to understand that that's their job, why would they think it's their job? That's on the one hand. But on the other hand, if we're not having conversations in child welfare with children about why they aren't living with their birth families, what are we talking to them about? And how are we helping them do the processing of their thoughts and feelings in preparation for whatever healing or work needs to be done for them to feel good about themselves and to feel supported and to feel connected and to be ready for permanency. So I that sort of lingers for me. And then I think about one of the modules that we see the lowest scoring in on the pre-test for mental health clinicians is around attachment. And I think about in a system where we have workers who can't talk about or aren't comfortable talking about loss and grief, making referrals to therapists who don't really know how to promote attachment, it's easy to see why we might have children and families who don't are struggling. And that for me is sort of a powerful, I don't know, it's not really a visual, but it's a powerful thought about the impact of this training. And if we can help provide skills and resources and tools for workers so that they have the skills they need to have those kinds of really difficult conversations, how impacts could be different, right? How outcomes could be different for children and families. So I just want to kind of leave that there as when we say NTI is not just training, it's practice changing, that's really what we're talking about, is that if you can take something from this that you can apply in your practice that can really have a difference with individuals you work with or families you work with, then that's the power of NTI. So I don't want to belabor the point. Anything, Dawn or Megan, that you want to add?
No, I mean, I think I just want to acknowledge and appreciate the partnership, and also that it was Megan and I presenting today, but we represent a fantastic team at our university, and much of this work is done with our brilliant colleagues, and a shout out to Aditi Pudel and Sarah Ibrahim for support of the data, and then for Don, your team, and their engagement with the data and interest in helping translate what we're seeing into making it effective and useful for the agencies that you work with. So.
Oh, that's great. And let me put a plug in for my team, because if you work with our implementation specialist, you're going to work with one of them. So Edna Davis, Shamel Hill, and LaShonda Kilgore are doing fabulous work. And Karen Meyer is our marketing manager. They're the ones who are going to do the work to help you implement NTI. And just a plug to Marcy, thank you for enrolling in the course. So we'd love to see that. And I know that Lauren did put in the chat the link for the survey. Is that right?
Yes, I can throw it in there again, so it's at the bottom.
Okay. And we would ask you, it's a very short survey. If you would just take a couple minutes to give us some feedback, that would be very helpful. All right. Any more questions? All right. If not, I guess we can give you a few minutes back. Thank you all.
Thank you.